So the first question really that I get is about weight problems. And as we get older, we seem to not be able to lose weight. Well, this is amazing. Actually, we start with a detox program. Let's help people understand. We start with a detox program that actually is really just taking a certain protein, medical food that I've developed, and just using it for 3 to 5 days in a certain program that I put together that you can find out by going on the website, www.drerika.com. And after about 3 to 5 days, most people lose between 5 and 10 pounds, which is amazing. I started it to help people balance their hormones, but as it turns out, just like the South Beach diet, people started losing weight. And then balancing hormones. And the balance of hormones is really important because doctors don't really think of it. I'm a conventionally trained doctor. I was practicing conventional medicine for many, many years, and I didn't realize that hormones are really crucial. So people don't even think about it. So you come in with a complaint of, let's say, weight gain, and you don't realize that what you really need is to have your hormones balanced, because you're not going to lose weight just by going on a diet. So we started realizing that and working with the hormones, that it became specific bioidentical hormones. Bioidentical hormones are hormones that are FDA approved, many types of them, or compounded specifically to your needs. In Wendy's case, I use compounded because I work with creams and they're easier to be worked with. And not every compounder, by the way, is the same. So sometimes you're better off with FDA-approved medication, bioidenticals, than with compounding. So you need more information, again, go to my website. The patients really do very well with the creams. We work with balancing their hormones with the bioidentical hormones. And then the diet, which I call the hormone-friendly diet that we bring in, which is kind of a gluten-free, wheat-free, no sugar substitutes, no white flour, and no dairy, and cutting out things over the course of time, but really balancing it will immediately help you lose weight. And then you start feeling better. The problem is that as you get older, and I'm not talking older like over 50, I'm talking older over 30, you have difficulty because you have difficulty balancing your hormones, and that's when you start having difficulty losing weight. So initially, if you think about it, when you're in your teens and 20s, you can eat McDonald's all day, and all you have to do is just stop and you'll lose weight. But what happens when you get to be 35, 40? What happens? You just can't. I mean, your body, and the reason your body can't lose the weight is because your hormones are out of balance. And that's something that the doctors will not tell you, and you need to start thinking yourself. Suzanne Somers wrote books about it. I've been writing about it since 15 years before Suzanne Somers, but you need to realize it's your hormones. Once you balance your hormones, you feel better.